Good morning. My name's Michaela Nuttall and I'm a nurse, and I'm delighted to have been invited along to this fantastic session for you guys today. I'm going to be chatting. Well, I've got about a half an hour slot as everybody else has, and I won't talk for too long. So please do feel free to post any questions that you might have in the chat. And you don't have to wait till the end to post them. I can pick them up as well as we go through, or if it doesn't seem relevant at that point in time, I'll gather them at the end. So now, I'm not one of those nurses that often when people say I'm a nurse and people automatically think, oh, which hospital do you work in? And I don't work in a hospital. I'm public health by background, so that means, public health we've heard a lot more about public health recently since COVID, but really I'm into prevention. I'm into getting people to live healthier lives for longer. And my session today is really to think about hearts and brains, and what's good for the heart is good for our brain. And so really it's looking at dementia prevention. Now, my slides aren't moving. So first of all, a tiny little outline on what is dementia. And really dementia is just a collection of symptoms that results from different diseases that happen to the brain. It's a progressive condition, and that means is it doesn't get better, it only gets worse over time. Now, our brains are made up of neurons. We have neurons, and that's how our messages pass up and down our spinal column and up to our brains. And we have neurons within them, and we've got billions of neurons, and they're the things that pass messages along. And that's how we can, that's what makes us us. All the different messages that we have that come up and down to our brain makes us us. And yet, what we do is, if you can see here, so I'm going to walk you through some of these things, and what you can see is the little neurons, which is all the blue bits that you see here, and those bright little sparks is the messages that travel along, and that is what makes us us. That allows us to smell, taste, see, hear, breathe, think, talk, walk. All of these messages are constantly moving, and we do it without even thinking about it. It just happens. And yet in dementia, the channels, those neurons and the messaging between those channels means that we cannot think and cannot be and cannot act and do as we were before, when those channels were working brilliantly. And that's in essence what happens with dementia. And this gets progressively worse. Now, we do know that actually a lot of the stuff we want to do is delay the onset. We can't ever stop these things from happening, but we want to delay the onset. So for me, I'd rather get Alzheimer's at 82 than at 75. And I'd rather get it at 82 than 80. And so everything we're doing is just looking at pushing it back. And if we do push back the onset of Alzheimer's by, say, 5 years for everybody, that would actually mean that there's half the number of people in this country living with Alzheimer's, which is truly amazing, truly amazing. And today I'm going to give you some ways of being able to think about how we can do that. But before we do that, what I want to do is I often do just a little quiz. And what I'm going to do is I'm going to show you some questions, and then you're going to think of the answer. You don't have to shout out the answer. You don't have to put it in the chat, and then I'm going to tell you the answer. So for people with dementia, how many actually developed it under the age of 65? How many people? And we know that a lot of people develop dementia in the over 65, but how many? Is it A, B, C, or D? Is it 1 in 50, 1 in 32, 1 in 20, or 1 in 12? So just give yourselves a little idea, and just have a moment to think of what answer would you actually put down. And the real answer is it's about 1 in 20. So you'll see the change in colour where it goes red. Probably doesn't show up, maybe hopefully it shows up okay on your screens. And so 1 in 20, that means for 19 out of every 20 people who develop dementia develop as we get older than 65. And so that means that actually by the time we are over 65, 1 in 14 people will develop dementia. And by the time we hit 80, 1 in 6 people. But an easier way to think about it is by the time we hit 65, our chances of developing Alzheimer's or vascular dementia doubles every 5 years. And so we can really want to do something about that by pushing it back as much as we can. And so let's think of that now. Although saying that, I'm just going to go back a tiny bit. Although a lot of these people here are over 65 who get dementia, 19 out of every 20, there is still 1 in every 20. And that means I think it's about 50,000, somewhere between 40,000 and 50,000 people in the UK develop dementia while still at working age, although working age is changing a lot for us. So it's not just something that happens as we get older, it's starting to happen to people younger and younger now. Okay, let's have a look at who is more likely to develop Alzheimer's. So remember, dementia is our umbrella term for different conditions, okay? We have Alzheimer's, we have vascular dementia, we have dementia with Lewy bodies, so we have this whole bundle of different conditions that are there. And often people have more than one, they have what's called mixed dementia. So we don't just develop one of them, we have a combination. But let's have a little think about how, who is more likely to develop Alzheimer's? So is it women, is it men, or is it about the same? And the answer is, well, it's women, okay? And we know that being female and being female for longer, because remember our bodies, when we were designed however many, hundreds of thousands of years ago, our bodies weren't designed to last as long as we're getting them to live now. When we were, in cavemen, that Paleontolic times, or even back in Greek and Roman times, we probably only lived till we were about 30. And so we are using our bodies. It's fantastic. We can have our bodies till we're about 70, 80, 90, 100. But our bodies were designed to work in a specific way. And particularly what happens is when we go through the menopause, we lose a lot of those female hormones, and we lose a lot of the stuff that had been protecting us. And now we're not only losing those hormones, but because we're living longer without that protection. And what we can see is that even if you take into account that men and women live for a different amount of time, because women are more likely to live a little bit longer, that's still not why that women do. And it is, they think, to do with this women's and the lack of hormones. So there has been a few discussions, and we certainly know HRT for many women can be a benefit. And it's not just the benefit now of managing symptoms of, that's particularly unpleasant through the menopause, but there's also thoughts of cardiovascular benefits and maybe some benefits in trying to push back that onset of dementia. And there are some quite newer studies that are just coming out that are starting to look at brain scans. Now, we know when we're born, our cells are dividing all the time, and that's why, remember when you were a kid and you cut yourself, it healed really quickly. And as we get older and we cut ourselves, it takes so much longer to heal. And certainly once we get into our 60s and 70s and 80s, it takes a very long time for things to heal. And that's to do with our cells and how quickly they replicate and how quickly they divide, or are they starting to die off. And so some scans are actually seeing, and I hesitate to tell my husband this one because I know he'll only throw it back at me. But actually some scans are seeing that we know that our brains, some of the brain cells do start to die off as we get older, but what they've started to see that in women, they might be dying off a little bit faster. And it's again linked back to being alive longer without those hormones. So something really interesting to be done there, I think. So what about the other dementias? Okay, so that's Alzheimer's itself, but what about the other ones? And so who is more at risk of those? Is it men? Is it women? Or is it about the same? So I'll give you a moment to think about it. Okay, and the answer is, well, it's about the same, mostly. Okay, mostly. And so because I'm a public health person, I don't just think about the people who are here now. I think about population, and I think about trends and the populations that are coming behind us. And we certainly know that, for for the last 100 years, we are been living longer and longer and longer. Our mortality, the age at which, our expected age at which we are going to last for, our bodies are going to last for, has been going up. But we've kind of plateaued now, and in that plateauing of it means that we are starting to have other things catch up within it, particularly around these conditions here. So we know that cardiovascular disease, which dementia is linked to, is usually, it was thought, if we went back 20, 30 years ago, it was thought that it was more likely to affect men. And it did to some extent. It did, and it happened a bit sooner because women were protected by hormones. But now we are losing that protection, and actually our risk factors. So if we smoke, are we overweight? Do we exercise? Do we eat a good diet? Has changed over the years. And so there's a great saying, well, I don't know if it's a great saying, but if we live like a man, we will die like a man. And women are now learning to, well, we're now living more like men. You know, we work at the same rate, if not harder. Apologies to all you men out there. But, you know, we smoke at the same rates. We have this, you know, we have a worse level of physical activity. Our weight we're gaining to be just as heavy as men. So we are now aligning ourselves to live like men a bit more. But we have, I mean, there comes a point in time in women's lives where we do lose that protection. So there is something in, it's not just men that get there. And when we're thinking about this and coming at it from dementia prevention, it really is getting different people, so whether you're younger, whatever your gender, to really think about how much is my risk of dementia and what can I do to stop it or slow it down. Which then takes me to, so what about our ethnicity? And we've certainly heard a lot of stuff in the last couple of years to do with COVID, and we know that COVID has really highlighted the inequalities that are out there. So have a think to yourself, who do you think, which ethnicities do you think are more likely to develop dementia? So is it being African, Afro-Caribbean, being Caucasian, South Asian and Caucasian, or being African, Afro-Caribbean or South Asian? So have a moment to pause. And I actually run this quiz, it's a much longer quiz with healthcare professionals, and I'll let you know, I've never had anybody get all of the questions right, but the questions get a little bit more complex. I'm not doing those ones today. And the answer actually is being African, Afro-Caribbean or South Asian. Now, normally what happens when we get this vote, I get a lot of people that say men are more likely to get dementia, and then I get a lot of people answering Caucasian here on this one. And that's often to do with, you know, what we think we see on the news and what we think we see. But people who are from different minority ethnic backgrounds are more likely to develop dementia. And this is for a combination of reasons, okay? So for people who are South Asian in heritage, well then, much more likely to get vascular dementia because of the fact that they're more likely to have heart attacks, strokes, hypertension, diabetes, and therefore more at risk of dementia. Whereas for people who are African, Afro-Caribbean, then more likely to develop dementia, but for a different route. So less likely to have the heart attacks, but more likely to have diabetes, high blood pressure, strokes, chronic kidney disease. And these are all which will all lead us down that pathway to developing sooner than what we would do. And this is down to no single individual reason. It's a whole combination of things. The environment, genetics, diet, smoking, levels of physical activity. There's no single thing that's there. So when we're looking at dementia prevention again and thinking who you are or who your friends are, who your family are, it's almost more important for us to start targeting and really thinking about we need to be more proactive if we want to stave off dementia, of which we do. We know that dementia is the most feared condition in the over 55s. Okay, I think this is my last question before we move on to other stuff, but I find sometimes asking questions this way helps to help people to understand it, particularly if you've had a bit of a quiz and you haven't got the right answer. You think, oh, so that's the answer. Now, we know that there are many people out there with who've got heart disease or who have type 2 diabetes, and we know type 2 diabetes is definitely on the increase and happening to people younger and younger. So having either of these conditions, how much more do you think it increases somebody's chances of developing dementia? Well, it either doubles, it's 2.5, 3 times as much, 3.5 times as much, or a whole bucket load. And I'll give you a moment again. And the answer is it doubles. Now, when I do this with healthcare professionals, they often say, oh, it's only twice as much. Yes, that's huge. It doubles somebody's chance of developing dementia. So I don't want to scare any of you guys out there that might have type 2 diabetes or heart disease, but actually it's even more important that you take good care of yourself, because it is about staving off that dementia. And we know with type 2 diabetes, for some people, we can put that almost into remission. We can reverse it by lifestyle changes. It's very hard. It's very easy to say lifestyle changes, but it's very hard to do. So the reasons why we get type 2 diabetes, the reason why we get type 2 diabetes and heart disease are usually to do with risk factors: what we eat, how much we move, what we drink, how much do we smoke. Yes, there's a role for our family history and genetics, and there's definitely our socioeconomic status makes a very big difference. But what we do as well, and how we live our lives and how we use our body really does make a difference. And so, yeah, both of these conditions do increase somebody's chances of having it. And so that really helps us then when we're trying to help promote lifestyle changes, because no one wants to get dementia, or we want to stave it off. Okay, I did have another question. I didn't realise I put all these ones in. So which of these conditions have actually been linked to dementia? So we have got I've got chronic kidney disease, anxiety, hearing loss, sleep apnea. So that's problems, when people sort of stop breathing almost. They snore very loud and then they stop breathing and they go, and then stop breathing again. And if you're married to somebody with that, you'll know. Okay, and sometimes people have to have a special mask that they sleep with, and social isolation or loneliness. And the answer is it's all of the above. Clearly, I've clicked the answer already. And that's because we know chronic kidney disease is linked to do now with cardiovascular disease, and so therefore puts us down the spectrum of developing dementia. When our bodies are anxious, so anxiety, when our bodies are anxious, it produces what we call inflammatory markers. It becomes angry. And I often liken inflammation to when you get a splinter and it goes a bit red and angry, that's inflammation. So anxiety produces chemicals from our brain that makes our bodies more angry, more inflamed, more of these inflammatory markers. The same with actually obesity does the same as that. Hearing loss, and that's particularly hearing loss as we get older. So we lose that ability to communicate. It's not like if we were doing it when we were younger, when we might be able to, learn speech, learn to lip read, learn sign language and stuff. So we lose that method of communication. Sleep apnea, and we put that up with cardiovascular disease, CKD, obesity, and of course social isolation and loneliness. That not engaging and not using our brains really means that we do increase our chances. And we know that running through the last 18 months will have had an effect on people for a lot of these reasons. Okay. Now, these are all really good things that we can do to reduce our chances of developing dementia. These are all absolutely brilliant. So keeping the brain active, stopping smoking, eating oily fish, drinking within safe limits, and being more physically active. These are all absolutely brilliant. But there is one that is better than all the others, okay? And many people are surprised to find out it is being physically active. Yes, keeping our brain active is very, very important, but being physically active brings about so many in here, so many different bits that physical activity does affect. It increases our chances of living longer, reduces dementia, heart disease, strokes, diabetes, some cancers, depression. If you're going to fall, it reduces your chances of fracturing a hip. Physical activity is amazing to be able to do. Right, so let's move on to, I've already mentioned that actually dementia is the most feared condition in the over 55s, and many people do not have a diagnosis of dementia who do have dementia, and many of us will care for somebody with dementia in our lifetime. So a lot of what I try and do is get people to look for early onset of dementia. Let's go and find it as soon as we can, and also support the people who are caring for those. And the messages I use in trying to prevent dementia is quite a simple one, and we use this a lot, is what's good for the heart is good for the brain. So everything, so I'm a heart disease nurse, that was my background, and I'm not a dementia nurse, but I like to think about I can preventing dementia when I'm preventing heart attacks there. So we know these are the risk factors for heart disease, which make them the risk factors for dementia. So, and I'll let you read through a lot of those that are there, but many of us do have some of these risk factors already, and it's about slowing down that progression that we can do. And what we're trying to do is protect that brain, protect our brain as long as we can. And we're trying to delay cognitive, what's called cognitive function. So let me show you this graph here. And I don't know if I don't think my little arrow is showing up, but what you can see, if you look at the blue line on the curve, you look at the blue line, that's almost like a what's called that's how our brain ages. Okay, this is how our brain ages and goes down. So as we get older, our functional activity levels of the brain goes down. But if we can do an intervention, and on this graph here, the intervention is at the age of 60, then we can push back. We can push back that onset, and we can maintain that brain function that's there. And really, that's what we're aiming to do. So there is something we can do, and it's really, this is an amazing thing. So what we want to be able to do is make sure that we keep, and although I've talked about physical activity, we want to keep using our brain. These neurons, anything we don't use gets pruned, they get trimmed back, and anything we do use gets strengthened. So it's almost like if you don't use it, you will lose it, okay? If you don't use it, you will lose it. And so that's what we're aiming to do, is always keep, and that's part of physical activity, yes, but brain activity too. But there is a really interesting study that looked at what happens if we combine both. And this was really incredible. And so what this looks at here is, so they divided the groups into two people. They had younger people and they had older people. Now, they divided those groups into two groups, and they put some people as walkers, and you can see a treadmill there, that's somebody's walking, and they made some groups navigators. And so what they had to do was be on the treadmill, but you can see that fella there having to navigate as a penguin round an area, and he had to do it. Now, the groups that did the walking, and you can see that on the little graph that the younger navigators, the younger walkers, got a higher performance function, so they had to do some tests and problem solvers. They already started from a higher baseline. And the walkers, the younger walkers, went up and they still maintained this higher level, which was absolutely brilliant. But the older walkers, look at what their level, they had more to gain from that physical activity, really helped to improve that brain function. Now, when they became navigators, the navigators, wow, well, what they did is their brain function, so exercising whilst using your brain, and that could be hard to do, you don't want to do a crossword on a bike. We saw this really increased ability to do problem solving, which was maintained afterwards, and we saw it in both the younger and the older groups of people here. So there really is, so this is why you can't, well, I'm going to do it now. I have a little exercise thing under my desk, and wherever possible, I try and cycle. So when I'm working hard and I'm really thinking, I actually have a little pedal just to try and think, can that make my brain work a little better? So interesting one there, I thought to find. So just how does exercise help us? And I thought I'm going to focus on exercise quite a bit for the next couple of minutes, is really because, and excuse this as being a set of slides, some slides with a really bit, but exercise is really good, and I'm going to use simple language. So basically, exercise makes, and the stuff you can see that's green, makes good stuff happen. It makes our bodies produce really good stuff, which has a positive effect on our memory, on our brain function, has a really positive effect. But on the left-hand side, you can see that when you exercise, it has a negative effect. So it reduces this inflammation, which has a negative effect on the brain. So exercise not only produces positive, but it reduces negative stuff. And that's why it's so powerful in preventing dementia and staving it off. Now I can see a question coming, so I will be answering that one in a moment. I'm just going to skip to this last slide because I can see we've got questions coming in already. So let's look at dementia. What happens to it? So on the left-hand side, we can see people with high blood pressure, high cholesterol, obesity, diabetes, and this has a direct effect. It really affects how our bodies work inside to be able to increase our chances of developing dementia. I want to be able to really understand there is this link. It's not that we have one set of conditions and as if like magic it comes through, we happen to have dementia. They are so directly linked. So I'm going to stop there because I can see some questions coming in and I've only got a couple of minutes left. So what is the difference between Alzheimer's and dementia? So dementia is the umbrella term, okay, the umbrella term that's there for different ones. So vascular dementia is where we get slightly blockages in the arteries that's up in our brains. And that the same blockages that cause the blockages to make heart attacks. Whereas Alzheimer's often means the messaging, you get these little build-ups of proteins between the neurons that sort of wrap together. That's quite a simple way of explaining it. Somebody's asked, what is BDNF and all the other acronyms? So they are literally a series of chemicals that our brains produce. So it's brain directed neuro something. I'm making that up, but impaired glucose. So don't worry about those. Apart from it just makes the good stuff better. That's the thing to try and really think about. Exercise makes the good stuff better rather than not having enough of that good stuff, which our brain absolutely needs. These are chemicals that our brains work with. So in my closing bits, and there hasn't been any more questions come in at the moment, so please do feel free to type them in whilst I'm waiting. I'm just going to wrap up with those messages that it doesn't have to be dementia. Many people think it's an inevitable thing, and it doesn't have to be. What we really want to be able to do is push it back and stave off that onset. So the messages are what's good for the heart is good for the brain. And that the best things we can do, physical activity, not smoking, living a healthy lifestyle, but also engaging with people, talking with people, really having a sense of wellness that's there. Look out for dementia, actively look for it, and know which people it's more likely to be there in. We know that our brains, as we get older, we forget things. But if anyone ever worries that they're forgetting things, their memory is becoming more of a problem than it should be, do seek advice. You can go direct to your GP, you can go to the Alzheimer's Society. There's a variety of different charities out there that have really great stuff. So I think that's me done. I hope that's been useful for you guys. I hope the quiz has been a bit helpful. You do have another session starting in 1 minute. So just to say, enjoy the rest of your sessions. Take care, everybody. Bye-bye.